The telltale signs of aging, wrinkles. Wouldn't it be great to soften those lines without changing the way we really look? An improvement to our appearance without changing our appearance. Dr. Anne Therese Stubbs from Anne Therese Aesthetic Medicine has a proven procedure to make us all look a bit better. Dr. Anne, nice to have you here.
Nice to be back.
And you sent us some pictures, which we'll get to in a minute. And the reason I say softens the wrinkles is because it really doesn't change a person's features.
That's right. And a lot of my patients come in and they say, okay, I'm not ready for a facelift, or I don't think I ever want a facelift, because they've seen pictures of people who don't truly look like themselves afterwards, or celebrities, some scary pictures there. And they really want to look better for their age, but they don't want to look different. They want to look like themselves maybe 10 years ago, softening of some lines, tightening of a jawline, or tightening of the forehead, or a little bit of an eyebrow lift. And lasers can affect that with a little bit of skin tightening.
What is this procedure, this specific laser we're talking about?
Now, this laser is called an erbium laser, and it's a peeling laser. So it's been well known for, you can take a little bit of a skin off and soften the skin, or you can go a lot deeper. And the peels that we're talking about today is deep laser resurfacing. So we're going a little bit deeper than the peels we've talked about before. So by doing that, you're evening out the little ridges or wrinkles in the skin, and you're also delivering a lot of deep heat that tightens the skin. And the tightening is what everybody loves.
Wow. And when I saw the before and after pictures, that's what I noticed. It did almost look as if you said some of the eye was lifted, which I didn't think you could get with a laser.
Well, we're finding that when we do a deeper peel, if we add some extra heat right afterward, the button on the laser is called the coagulation button, but it basically, a deep pulse peels the skin, and then you've got little pulses thereafter that just deliver a little bit of heat to the skin. So you are very red afterwards, and this is not a no downtime procedure. A lot of things we talk about here are you're back to work or back to school or back to life in just a day. This one you're healing for about a week, so I have to put that out there, that it's a week of being red, but it's not surgery, and that's what a lot of people like about it. It's like a sunburn the first day, and you're not hurting per se, so you're just very red, so you might not want to be in public, but you can certainly work at a computer. A lot of people who work at home find no trouble doing their work at home. You're just a little unsightly for about a week while your skin rejuvenates and comes back. So we peeled the top layers, put some deep heat in.
We're going to show those before and afters as we're talking about this too.
Yeah, it tightens. So this lady right here, you can kind of look at her eyebrow position in the picture
was amazing
before.
To me, yes.
And then when her forehead tightens, it actually raises her brow, and it tightens that crepey skin under the eyes that every woman hates.
Is it painful? You talk about the redness. Is this painful?
We do numb up the skin. So it is, if you would do it with no numbing medication, it certainly would be ouchy. This lady right here that we're looking at had a lot of pigmentation. She also was concerned about the crepiness underneath her eyes there. So it took off every bit of her sun damage and pigment, and what people call age spots, liver spots, all the different words we use for those unsightly pigmentations on our skin. All that is taken right off, and the new skin comes up in a pigment-free fashion. This picture we're looking at here is these perioral lines, or the little vertical lines that form around the lips. A lot of people call them smoker's lines, but everybody gets them, even if you don't smoke. If you think about it, everybody uses a straw, a water bottle, even the letter W, sometimes. You're working that muscle. And you just get those little vertical lines there because the skin tends to thin around especially women's lips. So by doing a peel right around that area, it tightens and it kind of resurfaces that area so that those fine lines are gone.
So can you just do it at a certain part, like the lip area, or is this something that should be done overall?
We do the whole face. We might do different depths. So if your problem area is around your lips, we can go deeper there, and we can resurface more deeply and tighten more around the lips. Or if someone says, hey, my eyes are my concern, I don't like this crepey skin, or I want my brows up a little bit, we can tailor this resurfacing to go deeper in certain areas. We do the whole face at a certain level just because we want it to blend nicely. We wouldn't want the pigment to be different right around here.
That's what I wondered. That's what happened,
nice and
right?
fresh and new, and then we've still got some crepey skin on the cheeks. So we kind of taper it and we onto the cheek area, or look at the person's areas of concern and tailor that way.
And lastly, the benefits between this and a facelift. There's no surgery, so you don't go under anesthesia.
Yes, beautiful that it's no general anesthesia. We do a local numbing of the face just with some topical cream, and then we put a little bit of lidocaine in the skin as well, similar to being at the dentist, and that usually wears off in the next hour or so. But people are very comfortable during the peel. Your first day is a little ouchy like a sunburn, and we usually just have people putting on a lot of Aquaphor, which is a heavy emollient on the skin, and just kind of, we say go home, watch some good movies, and just stay out of the sun and stay out of the public eye for a few days.
And it'll last a long, most people say that the effect is How long?
Well, it basically, we can never stop the hands of time, tragically.
Yes.
But we, by staying out of the sun, good skincare products afterwards, a lot of people remain pigment-free and don't get that pigment back. And then with time, eventually the collagen will start to age. But it's a natural process. And some people will do it every 5 years or so just to get that little tightening and try to avoid the knife.
Well, Dr. Anne, this is very impressive pictures and an impressive procedure. Thanks. Nice to see you.
Good to see you, too.